Bladder leakage. Yep, you heard me correctly. Something most of us prefer not to discuss in public, but likely have experienced in one way or another. In fact, over 25 million people in the United States are dealing with urinary incontinence. It affects twice as many women than men, and more than half of those with symptoms have not spoken to their doctors, mostly due to embarrassment. It's time to have some candid girl talk this morning, and who better to have girl talk with than Dr. Conlen, OBGYN. Welcome back, Dr. Conlen.
Good morning, Erica, and thank you for inviting me for some girl talk.
You're the best guy to speak to. It's true, this is an embarrassing subject, but I think if we're honest and we're frank and we have some fun with it, we'll answer some really good questions.
Absolutely. It's a concern for women. It can affect many people. It inhibits their lifestyle. It could be devastating.
When so many people think of leaking bladders and overactive bladders, they think it's something that comes with age. Is that true?
Yes and no.
Okay.
It can occur in the younger person in the 20s if there's a medical issue that's going along with it. When we were young, we trained the bladder. So things that can affect the retraining or untraining of the bladder as we get older can occur at any age. Mostly, though, you're not going to see it in the 20s, but you'll see it after childbearing, maybe in the 30s, perimenopausal, postmenopausal, and in the older female.
And so why does it happen? What's the physiology behind it?
We learned how to control our bladder when we were children. All right, and it was all timing, and it's all manifested by the brain and the neurons that are going back and forth. But as time goes on, the environment and our lifestyle stresses us and makes us conform to different timings and different schedules. And then, of course, with pregnancy, that's going to affect some of the anatomy. But basically what happens is that the bladder is trained and retrained as we get older. And for people that are in jobs where they have to stand all day and they can't go to the restroom on a regular basis, their bladders get used to being over-distended. So it's a combination, and there's several different types and methods for dealing with each one.
I think when we hear the word incontinence, it's referred to in many ways. It's a leaky bladder or overactive bladder. Can you tell me a little bit about the differences?
Yes, the bladder is like a balloon with muscles that go all different ways. If there's something that's irritating the bladder, whether it be a medical problem, a neurological problem that can occur, or even from what they're intaking, what they're drinking, coffee, soda, even some medicines that can irritate the lining, it makes the bladder irritable. And then there's urge incontinence. And this is where you know you have to get to the restroom, but you're not going to get there in time. So you may be 3 feet short. And what happens here is that over time you have trained your bladder not to tell you when it's getting full. It just gets to a certain point and then you have to go.
And that can be a significant amount of
That
fluid.
could be an emptying.
Oh, wow.
So that can be quite devastating, all right? And that's something that we really see a lot of. Many times that's what is the initial issue. And then after we speak with the patients ongoing, then we find out there's a stress incontinence component. And what that is that sudden increase in abdominal pressure from either exercising or stepping off a curb or sneezing or even coughing causes you to leak a little bit.
Okay, and so urges really could be a large amount of
Yes.
fluid, where stress is...
Just maybe a little bit, but you know, there's no hard rules on any of this. It depends on the individual.
And equally difficult to deal with in everyday life, obviously.
In today's lifestyle, being very busy and active and out all day, it can cause people not to go out. It can make them homebound.
Yeah. So then the question is, obviously, what can we do to sort of prevent or manage all of these things?
One of the earliest and best things to do is to take a look and see your lifestyle. So if you're drinking a lot of coffee, soda, and not drinking a lot of water, then those byproducts, the metabolites, are going to sit in the bladder and they may become irritable.
People who are suffering with incontinence think they shouldn't drink that much water. Is that the case?
Well, of course, that's the first thing that they want to do, is they'll stop drinking. And that's the last thing they should do, because as we talked about, it concentrates the urine that's in there. But more importantly, if you hydrate yourself, it's how you hydrate yourself. I tell many of my patients, make sure you take a bottle of water with you and work on it all day long. And the other thing that's very important, and this is just the first initial step, is I explain to them they should be voiding by the clock. So for urge incontinence, because they're in the habit of waiting too long, I tell them that they should try and urinate every 90 minutes. It's a good spot to start retraining the bladder so that it's telling you when it's getting a little full. And it is very successful as long as there's no underlying pathology. So it's always make sure that you see a physician and get checked and make sure there's nothing going on that's serious. And the other thing is to manage the leakage with over-the-counter products such as we have here.
So doctor, I walk into the store and there are so many options. It can be incredibly confusing. How do I know what I need?
You're right, there is a lot of variety. But let's take a look at the TENA Intimates.
Okay.
This company has been doing this for 60 years, so it's a great place to start. They're an excellent example of what you should be looking for. It's important that you go ahead and you get a product that has certain criteria with it. So it's very important to take a look and see how the pad functions. One of the most important things is going to be moisture wicking.
Okay.
You want the moisture to be drawn away from the body so that it does not irritate the skin. And also, you want to have odor protection. That's very important. So by taking care of the odor, the wicking, as well as no perfumes, you're going to decrease the possibility of irritation to the patient. People are going to change these a couple times during the day, so it's very important. It must be comfortable. They have many different sizes and shapes to accommodate each individual.
It's all about being comfortable and being confident.
Absolutely.
Doctor, thank you so much for joining us for some girl talk. It's always a pleasure to have you here.
Anytime.
If you're having trouble with urinary incontinence, we urge you to talk to your doctor to make sure it's not anything serious. For more information on the tips and a free sample of the products discussed here today, visit TENA.US/accesshealth. And as always, you can go to our website at accesshealth.tv.